Alright, hi everyone, welcome to the Assunta Podcast. My name is Danial.
And I'm Alia. Today we'll be discussing about dengue fever with our emergency physician, Dr. Ganasan.
Alright, without further ado, let's begin.
Okay, so we jump straight to our first guest, Dr. Ganasan, the one and only EP. Okay, so maybe Dr. Ganasan, you can just a little bit introduce about yourself and also what is
Your
EP
background
basically lah, because some of our listener didn't know what is EP, right? So maybe you can just give a little bit of introductions about that.
Yeah.
Sure, why not? Hi, ladies and gentlemen. My name is Dr. Ganasan. I am the emergency physician in Assunta Hospital. So the short name is EP. We call the emergency physician as EP. So basically, emergency physician is relatively a quite new field in the medical fraternity. What we do is that we do acute care in emergency department, and we also render the accurate or the most accurate diagnosis and treatment as early as possible, as soon as you step into the hospital, to ensure that your recovery is faster and also the management is rendered at a very crucial time. So our scope is basically to identify any life-threatening condition, and then to execute any investigations or any imaging which will lead or which will give us the diagnosis and of course the treatment as well. So many of us fail to understand the part where emergency management should be given timely as possible, and also it has to be given as soon as possible. Any delays in that management can cause delay in recovery, or worse still, they can lead to worsening of the symptoms. So this is where our expertise comes in, where we do the management as soon as possible. So to put it in a very blank statement, we deliver specialist or specialized care the moment you step into the emergency department. That is our...
Means that doctor, the first who come to the hospital will visit for emergency first, is it?
Typically, traditionally, there's two ways the patient can actually come to the hospital. One is, of course, to the specialist clinic, where most of the cases that comes to specialist clinic are very, very stable cases. Whereas in emergency department, it's a bit different, where patient comes with acute symptoms, a sudden onset of any symptoms, where they walk into emergency department. Now the trick is this, is that we are supposed to listen to their complaint and then come up with the proper diagnosis, so that we can tackle the issue that they come in with. So these are the two ways that they actually come to the hospital.
So once you identify the problems, you will pass to others specialists.
Yes, correct. The emergency management will be done in emergency department. Once the patient has been stabilized, then we will, of course, call up the respective specialties to come over and take over the cases, so that they can continue the management in ward. So the decision whether the patient needs to be admitted, what are the risks for the patient if they are going back home, what would be the best care given in emergency department, is where our specialty lies on.
Understood, doctor. Alright, so today basically our main topic is regarding dengue fever, doctor.
Alright.
So if let's say, how we determine dengue fever basically? Is it in how to say, in medical terms, dengue fever? What is dengue fever basically?
So very important topic, I feel, right? I'm not sure how many of y'all are aware, but dengue fever is one of the important topics, and also the incidence of dengue fever that is happening in our country has been increasing year by year.
Oh yeah.
Yeah.
Okay.
So we have evolved a lot from dengue management. Today, the dengue management has been very specific. So just to give an overview
Mhm,
to
mhm.
all of us
Yeah.
and to the audience, what is dengue fever basically, right? Dengue fever is basically a viral fever. Okay, all right. Like any other viral fever, it's a viral fever. It is a mosquito-borne infection caused by Aedes aegypti, all right? And it's basically transmitted to us from the mosquito per se. Like any other viral fever, dengue fever comes from the family called flavivirus. All right, we got 4 stereotypes. 4 stereotypes means 4 types of dengue.
Okay.
Dengue virus
Okay.
1, 2, 3, and 4.
Okay.
All right. So it comes in that form of infection. It's a viral infection. Yeah. So what are the symptoms of dengue fever, you may ask? Like any other viral symptoms, it starts with fever, very high fever. Most of the time, the temperature can be 38 and above. Okay, and then it comes with arthralgia and myalgia. What is arthralgia, myalgia? Basically, arthralgia means it's a pain in your bone. You feel like your bone is very painful.
Okay.
Whereas myalgia is pain over the muscle region. So you will have severe arthralgia and myalgia. Okay, some may present with vomiting, some may not present with vomiting, diarrhea, abdominal pain, and we got a specific rash in dengue fever. We call it dengue rash. Okay. So these are the very common symptoms that you can actually get when you are infected with dengue
So
virus.
how was doctor diagnosed that, okay, this patient Alia, after check everything, oh, you ada dengue. So macam mana the doctor will diagnose that, oh, you vomit lah, you feel not good, not so good, or you have any specific blood test or anything?
Okay, of course. Now this is the challenge, yeah. Like I said, dengue fever is like any other viral fever, right? So we got so many viral fever. Influenza is a viral fever. COVID is a viral fever. Dengue is a viral fever. So many viral fevers around. Okay. So what we normally do is that when patient comes to us, all right, we will look for the symptoms, which is all the symptoms that I actually told you. Now we have to decide whether this is dengue or this is not dengue or could be anything else. So where I been trained, I've trained in the government hospital, Klang Hospital, and all the other hospital, right? Since in Selangor and Klang Valley, okay, the incidences or the prevalences of dengue fever
It's
is
a
very high.
hotspot lah.
It's a hotspot, you know, it's a hotspot. So any fever that comes to us, the first thing that run through our mind is whether it's dengue or not dengue.
Okay.
So the easiest way for us to find out whether this is dengue or not dengue is, of course, the symptoms. Number 2 is blood investigation. So what can we do? We have dengue combo kit or dengue testing kit. All right. So in
Similar like COVID kit, something,
correct,
is it?
correct. Okay, but this is not saliva. This is not swab, but this is actually from your blood.
Blood swab.
We draw your blood, and then we do the dengue test. So inside the dengue test, there's 3 panels that we are looking at. One is NS1, okay, then IgG and IgM. So different panels will be reflecting positive at different timelines. Okay, so that is method number 1. Method number 2 is that we will do the normal blood, we call it full blood count. Now in this full blood count for viral fever, there's a certain pattern that we look at, whether the white blood cell count is low and the platelet is low, and we look at the hematocrit. Hematocrit is basically to see whether your blood is thick or not, right? So these are the 2 most common ways or most accurate ways for us to diagnose dengue fever.
I see. So we already know roughly the symptoms where they come from, and then how about the treatment, doctor? Previously, when I was kid, doctor, there was a traditional treatment which is my parents will boil the papaya leaf and then let us to drink, and then another way is
Crab soup.
crab
Crab
soup.
soup.
Yeah, crab soup. So is it legit, doctor, for the traditional way, or we got any simple like paracetamol or something like that?
Okay, all right. So we I will answer the question based on the clinical practice guidelines, which is recommended by Ministry of Health. Yeah. Okay, the main stray of management for dengue, all right, is actually managing the fluids. All right. Now, it is very important for us to manage the fluids. Okay, let me tell you why. Okay, before we go into the management part, let me recap a bit on the dengue fever per se, the stages of dengue fever, so that you know the importance of it. Yeah. So like I said, dengue fever comes with fever, right? Now the febrile phase basically is fever, high fever, and you have all the symptoms I told you. Now the most critical part of dengue fever is actually at the second phase, what we call as critical phase. Okay. At this critical phase, which happens after 48 hours of you being infected with dengue fever, all right, what happens? Basically, your blood parameters will be going haywire, all right, meaning your white blood count will be low, your platelet will be very low. So what is platelet? Platelet, to put in a layman term, is darah kuning lah. Okay, darah kuning ni biasanya dia bertanggungjawab untuk to stop bleeding, coagulations and all these things.
Oh, so that's why when we come hospital, they will say, your platelet is dropped, so it's dangerous for us lah.
Yes. So if your platelet is very low, you tend to bleed. Okay, boleh berdarah daripada mana-mana lah, from your brain, from your stomach, any part of it. Most commonly is that. Alright, that's the blood parameters will be haywire a bit. Number two is that this is the time where you will have bleeding. Like I told you, you can be bleeding from your stomach or from your gum or in your brains or anywhere. Okay, you can bleed. Number two is that what does this dengue fever does is that it causes like a leakage in your vessels. Okay, macam dalam saluran darah tu macam ada kebocoran sikit. So what happens? The water leaks out from the vessels, okay, and then it goes and accumulates in your lungs, okay, in your body. So the critical phase is where the most dangerous time that we want to monitor the patient very closely, okay. And the third phase is the recovery phase, where you are out from your critical phase, then you recover. Okay, all right. So then we'll come back to the warning sign and what is not warning sign. Okay, so most of the time, right, if dengue fever, all right, you have all this fever and all the other symptoms, we will decide whether the patient is with a warning sign or no warning sign. So apa maksud warning sign? Warning sign adalah tanda-tanda yang mengatakan pada kita that the patient needs more closer monitoring, more accurate management. Okay, so what is the warning sign? Okay, so one is vomiting, persistent vomiting. Okay, to be more exact, if it's more than 3 times in 24 hours. Okay, number two is diarrhea. Okay, same, more than 3 times in 24 hours. Then is the abdominal pain, sakit perut, lebih kepada gastric pain ke ataupun sakit di seluruh abdomen. Okay, abdominal pain. Liver tenderness ataupun sakit di bahagian hati, mostly over the right side of upper quadrant. Okay, you have pain. Okay, lethargy, sangat lesu, tak boleh nak bangun, tak boleh nak minum. Okay, so these are the warning signs that we look out for. And bleeding tendency. Bleeding tendency is like how I say lah. Kadang-kadang patient akan datang, dia cakap, doktor, saya demam 2-3 hari ni. Lepas tu, hari ni saya gosok gigi, tiba-tiba berdarah pula. Hari ni saya tak gosok pun dah berdarah dah pula. You know? So, these are the things that we want to look for. So, if you have dengue fever and you have warning sign, okay, then it is very, very important for us to monitor you closely. Okay?
Okay, so basically, doctor just wondering lah, because like you mentioned what we call for this dengue fever, they do have diarrhea, vomitings, abdominal pain. So, but if let's say what we call the patients come to you, he or he only got vomiting or diarrhea only. So, is it like we can classify
assume,
that one as a dengue fever or how, doctor?
Okay, so if your blood panels like NS1 IgG is positive, if they come with any one symptoms of the warning sign that I mentioned to you, it's considered warning sign.
Understood. Okay.
Okay. Alright. For doctors, let's say a patient comes to me, dia ada fever, NS1 is positive katakan, tapi dia tak ada muntah, tak ada cerit, tak ada sakit perut, tapi minum tu boleh lah, boleh minum sikit-sikit lah, okay. Then I will do the blood test. Tiba-tiba platelet dia katakan ialah 20, okay, and the white blood count is about 1.7 katakan. So that is considered a warning sign, okay, for us, because there is a drastic drop in platelet and also the WBC. Alright, so that is one. Warning sign yang lain yang doktor akan tengok ialah bila dia buat blood tu, dia akan buat test untuk liver function test. Jika liver function test tu kalau ada perubahan, okay, then it considered as warning sign ataupun kita panggil transaminitis lah, okay. So it's a warning sign. So these are the blood parameters warning that the doctors will look for. So kadang-kadang if you were to go to the hospital, doktor ambil darah, dia hantar lah full blood count lah, liver lah. Kadang-kadang tengah fikir kenapa ni doktor hantar semua benda-benda ni kan. We are looking for that.
Understood.
Memang daripada history saya boleh dapat you ada demam, batuk, muntah, cerit-berit dan sebagainya. Tapi kalau yang tu semua tak ada, we will do this to ensure that your biochemical parameters are all stable. Kalau tak stable, we also consider as warning sign.
Understood.
Okay. So like I said, warning sign must have been.
Okay, understood, doctor. So if let's say, doctor, so if touch wood lah, the dengue, we are already recovering.
Okay.
So how do we want to prevent? Like for example, COVID, we have our COVID vaccination.
Okay.
And then like babies, we got the vaccination for babies. So is it dengue got their own vaccination or how is it?
Doctor?
Okay, alright. So we are looking into the management of dengue, kan? Okay.
So to prevent it before happen lah.
Okay. So normally I like to divide the management of dengue into two parts. One is the acute management, where you are treated in the hospital. Another one is the prevention management. So we'll start with acute. Is it okay?
Yeah, can.
Okay. So acute management for dengue fever, like I told you, it's fluids, and also controlling your fever. Okay. So apa maksud tu? Maksudnya ialah you cannot give anything more in terms of fluids kepada patient, and you cannot give anything less in terms of fluid to the patient. So there's a very famous saying by my mentors back at hospitals, right? No one drop more, no one drop less. Okay, so it's very specific. So katakan you come to hospital and you have warning sign, kita akan tengok blood parameters, kita akan do some other method to see berapa banyak fluids yang you boleh terima. Okay, your capacity of taking fluids and my capacity of taking fluids will be different. Okay, a patient who comes with the age of 70, his capacity of taking fluids will be different, your capacity will be different. Now, this is where we in emergency department come into the play, where we will determine what is the best amount of fluids to be given to you. Okay, so if you go back to what I told just now, dia macam ada leaking kan, air keluar, alright, so air dalam saluran tu dah kurang. Okay, kita kena replenish balik benda tu, right? So that is what we are trying to do. So how do we do that? Okay, not exactly. Vaccination is actually prevention type of it. But in acute management, what we normally do is that in emergency department, like I told you, dengue management has evolved. Betul? So in the emergency department, what we do an emergency ultrasound. It is not like ultrasound yang kita buat dekat radiology department ke apa. It's a very specific, focused ultrasound, where kita akan check sama ada air dia cukup ke tak cukup dalam badan. we have certain method. We measure the IBC, kita akan check jantung dia lemah ke tak lemah ke, boleh bagi dia lebih duit air ke tak boleh ke. All that we will do in emergency department, and then we will decide, okay, this patient perlukan this much of fluids based on your body weight. Okay, so that is the acute management number 1. So, and the fluid management ni akan berubah dari masa ke masa. Okay, maybe every hour can change, maybe after a few hours can change. Alright, like I said, cannot be more, cannot be less, can be just right on the point. Okay, number 2 is that control the fever lah. Paracetamol is the main medication that we give lah. You know, sometimes patient akan datang, lepas tu cakap, saya sakit sangat doktor, bagilah ubat tahan sakit.
So we give paracetamol, is it?
We just only give paracetamol. Okay? It is not advised for anybody to take painkillers when they have dengue infection. Why? Because it causes bleeding. Sometimes it causes bleeding. So that is why we don't advocate. Okay? Number 3, we will ask the patient to drink. Minumlah banyak. We are talking about 2 to 3 liters a day.
So that's why when people are dengue, you are putting water inside the
Yes, correct. So that's the fluid that I'm talking about, where you will give the correct amount. As the patient can drink more water, then we will reduce the fluid. So it is all dynamic. It's not as basically a standard treatment. It's all dynamic. Of course, the principle is there, but it differs from one patient to another patient. So it's more of a personalized care nowadays rather than a standard care. Alright, so that is one. That is the acute management of it. Okay, when you're hospitalized. Now,
okay, sorry doctor. If let's say regarding the fluid one, if let's say we are giving maybe not in the right amount, so what happened to that patient?
Okay, so maksudnya what happens is, remember the leakage that I'm talking about. Air akan keluar daripada saluran darah tu lebih banyak daripada apa yang kita replenish. Darah akan jadi pekat.
Okay.
Right? So it will cause more complication. Okay, so meaning that the incidences of complication because of the dengue fever and no proper fluid management will be high. So, and I would like to stress this point. Dengue fever can be fatal. Dengue fever can be fatal. Patient boleh meninggal disebabkan oleh jangkitan dengue fever. So our concern is that something that we can treat, we should be able to treat it properly. Of course, if the patient presents to us in a very late stage, then that is we will do our best, yeah, but it can be fatal. Right, so please always must remember this lah.
So if let's say you guys got any symptom of fever, just immediately come to find the specialist lah to help you guys, correct?
Yes, please don't take it lightly, yeah. Don't take it lightly.
Because some of them demam sikit je, Panadol elok lah.
Yeah, betul. So the awareness of dengue fever has to be always there in the community, especially those who are staying in the hotspot. Okay, so that is the acute management. Okay, so now let's move to other management type of it. Number 1 is awareness. Okay, kita kena jaga kita sendiri. Okay, so we need to find out whether there's any breathing places, air bertakung ke, jangan buat air bertakung.
One before that, doctor. So if let's say hospital already diagnosed this person dengue. So is it you guys need our hospital, is it need to report to KKM or some unit for prevention at the area? Because sometime when my neighbor dengue, 1 or 2 days later there was a dengue fogging come to prevention and everything.
Alright.
So is it need to report or something?
Yeah, it's a notifiable disease. Yeah. Ministry of Health is very serious about controlling dengue and making sure that we move towards dengue-free nation or something like that, somewhere around that. So every dengue cases that is being diagnosed in any center, doesn't matter in clinic, hospital or anywhere, it has to be notified to the KKM. right? So what they will do is that once they receive the notification, they will go to the particular area, to the house, and then they will do the inspection and see whether there's any breeding mosquitoes there, and then they will do the fogging so that the place is somehow controlled from having a dengue outbreak over there. So yeah, it is a notifiable disease here. Yeah. So coming back to the
Continue.
prevention. No problem. So the prevention. Number one thing that we always stress to people outside public is that you need to take care of your surrounding in order for us to be living healthy and disease free, right? So dengue is one of it. Basically, you look for any places there is any breeding. Okay, so try not to have any air bertakung lah, air yang tak bergerak. So there'll be the breeding focus for them, especially in our tropical country. Okay, kalau dalam taman perubahan ni biasanya perumahan ni dia akan buat apa, gotong royong lah dan sebagainya kan. So kena buat benda-benda macam tu. Okay, so that's number one. Number two is every single person who lives around the hotspot area or even in Malaysia lah, they should know what is dengue and they should know what are the symptoms of dengue, and they also should know when to go and see the doctor.
Okay.
Alright? Okay. Number three is, of course, the latest weapon or the latest management on preventing dengue is the dengue vaccine, right? Which has been recently launched in Malaysia, and using the vaccine will help you to prevent, number one, but it doesn't completely stop you from getting a dengue fever. But what it does is that it reduces the severity sometimes. Yeah, right. So there is, of course, a good amount of statistics to say that it's effective. So yeah, dengue vaccine is another model or another way you want to look at it, whether you want to take it or not.
So if let's say vaccine, doctor, is it anywhere that we can take the vaccination or got specific?
Okay.
If Assunta got vaccine?
Okay,
or how
yeah.
is it?
The availability of vaccine, it is not as vast as COVID, right? In most of the bigger centers, I presume we have, but in Assunta we have.
So you guys
can come to Assunta.
who want to have a vaccination for dengue, you can come to Assunta lah and
Yes.
make Dr. Ganasan.
Yeah. when they come, then we can explain to them what is the what this dengue vaccine is all about and all these things. Yeah, we can do that. Yes.
Okay. So doctor, maybe I'm not sure if there is any other questions after this, but last for me, okay, since you mentioned there is a fatality in this dengue fever, so maybe you know regarding the fatality rates in Malaysia.
Okay. I can't recall the exact percentage of it. Fatality of dengue often involved in few factors lah. Some of the factors are late presentation, because like what you said, they say demam je, ambil Panadol dulu, lepas tu tengok macam mana, lepas tu I can share you something why sometimes people come to us late. When you track back my conversation with you, right? I explained to you that dengue fever got 3 stages, right? Okay, febrile, critical, and recovery. So the febrile phase where the fever is high, after the 48 hours or 72 hours, biasanya demam tu dah tak ada.
Okay.
So as a layman, you akan rasa macam mana? Saya ambil
sihat,
Panadol, saya dah okey dah,
Yes.
tapi badan saya rasa lesu-lesu sikit, lepas tu saya rasa muntah, mungkin saya tak makan 2-3 hari ni, lepas tu saya dapat gastrik, saya muntah lah kan. You akan rasa macam tu, betul? Alright, then okay, you will just observe another 2-3 days. Remember, the critical phase is the most important or most dangerous time. I told you, the time that everything happens, leakage lah, pendarahan lah, semua berlaku, right? So that is the time you rasa okay lah, saya observe dulu, tengok macam mana, kalau tak okay baru saya pergi. So during that critical phase, dia makin teruk, then they present to hospital when they are at the late stage, so it makes the management more complex. Okay, what I'm telling you now in the terms of management is very simple, tetapi when we get a severe dengue, the management is very, very complex. Okay, so so That is the fatality is one. Okay. Number two is that elderly patients, or we call that extreme ages. Okay. Katakan children, okay, when they get fever, when they get dengue, okay, their body reacts differently. Okay. When the elderly patients more than 60 years old, mentah-mentah lagi kalau dia orang ada diabetes, hypertension, heart disease, kidney disease, ataupun all the mothers who are pregnant, okay, their body reaction is different. Okay, so when this group of patient comes to us, all right, at the late stage, or they don't come and see us, then the fatality can happen. All right. So always remember, extreme ages, like pediatric population and also the elderly group and the pregnant mothers, must always make sure that you come and check and make sure that you don't have dengue. Alright? Okay. Most of the time.
So if who kena dengue, immediately come to hospital, clinic first lah.
Dia tak tahu dulu dia kena dengue. Kalau ada demam
if
tu,
got the symptom and everything, just refer to the nearest doctor, and then the nearest doctor will advise you lah. You need to refer to the hospital or what lah, basically. Right?
Okay. Okay, so Doctor, maybe last conclusions from you regarding this today's topics.
Okay.
Yeah.
Alright.
Maybe anything you want to advise our listener.
So I think you already wrap up all regarding the dengue fever.
I hope if the public got any other question they want to ask,
you can jot down in the comment below. So doctor will reply you lah, basically.
Yeah, I'll try to reply your questions. Right? No, in future you will have more knowledge about dengue. Alright. So my conclusion of our topic today regarding dengue fever is that never take any fever lightly. Alright. Okay. Especially if you're staying in hotspot area or even in Malaysia hotspot area. When you have fever and all the warning signs that I told you, I recall back. Okay, arthralgia,
the
sakit,
3 warning signs.
arthralgia, myalgia, sakit pada tulang, sakit pada otot, muntah, cereberit, sakit perut, sakit dekat bahagian hati, lepas tu any bleeding tendency. So if you have any of these symptoms, immediately go and check. Alright, find out whether you have dengue or not. Okay, and the management of dengue is basically trying to give you the appropriate amount of fluids and the appropriate amount of time. Okay, that's the idea. Right? How do we deliver that? There's so many methods. Okay, so if you can drink, you can drink. Oh yeah, before we finish, you were asking me this papaya extract, ketam dan sebagainya.
So is it cure basically?
No, basically it's like this. I mean, of course, in the guidelines didn't really mention or didn't really say anything about it, and there is no any studies to say that it's actually maybe there is one or two, but there is no any big studies to say it actually helps. But technically, the management of dengue is what? It's fluids, right? So if you're drinking papaya extract ke, you're drinking sup ketam ke, sup ayam ke, alright, it's okay, it's still fluids. Okay, indirectly it helps you to this one, but it is not the remedy.
If you guys don't be your own doctor, basically. just find the nearest specialist to cure your health, basically.
Yeah, it's not a remedy. Please remember, it's not a remedy. I'm not stopping you from drinking, but it is not the remedy. Okay. And you know, those days when my mother or some of my uncle, auntie, if you get dengue, go and buy 100 plus. Drink the 100 plus. Only drink the 100 plus. No, it doesn't work that way. You know, you are supposed to drink fluids. Okay, and possibly if you can drink fluids which is not sweet.
Okay.
Because the idea behind why you don't want to drink a lot of sweet drinks is that our body reacts such a way that if you drink sweet drinks, you will urinate more.
Okay.
Do you understand? Understand? Okay.
Yeah.
So we don't want the fluids to go down lah, dia tengah leaking. We don't want it to go out a lot.
So another simple way is to clear our circulation. Okay lah.
Yeah, you can drink lah, but don't depend 100% dalam 100 plus lah
Yeah.
Sometimes
dan
like
sebagainya. No need.
No need.
You can drink any sort of drinks, but don't concentrate on only one type. I remember 100 plus saja dia suruh minum.
Yeah.
Botol-botol dia beli 100 plus macam tu kan.
Yeah. Okay.
Okay. Alright.
Okay. So, by the way, thank you so much, Dr. Ganasan. Okay,
Thank you.
for today's
Session.
topic, today's sessions. Okay, so there's a lots of things Dr. Ganasan have been advised us also. Okay, and also explained to us regarding the dengue fever itself. Okay, so thank you so much, everyone, for listening today. Okay,
So if let's say you guys want more topic, one more related topic regarding the hospital or what, you can list down the comment what topic the next that we need to
yeah.
discover lah. Basically.
Yeah.
Alright, thank you guys for
Thank
having
you
us.
so much.
Thank you.
Thank you, Doctor, for having us.
Okay.
Thank you.
Anyway,
Alright.
it's this podcast is being held during our Chinese New Year. So to all the people out there,
Yeah.
Happy Chinese New Year.
And Gong Xi Fa Cai.
And Gong Xi Fa Cai from the Assunta Hospital. Yeah.
Yeah.
Alright.
Have
Okay.
a safe celebration.
Alright,
Okay,
thank you.
thank you.
Bye.
Bye.